So, doctor, where is the carpal tunnel?
Carpal tunnel is right here under the palm of the hand, also by the wrist, if you will. The main nerve to the hand, the median nerve, goes through it. It controls sensation to the thumb, index, middle finger, and half the ring finger, sometimes other fingers because there can be cross connections. Also, all the tendons that move the fingers and the thumb of the hand go through that with their tendon lining. Sometimes that lining will swell up for whatever reason, swelling, overuse sometimes, trauma, or some people, as they age, the carpal tunnel gets smaller, then the nerve gets pinched, and that can cause carpal tunnel syndrome.
How do I know if I have carpal tunnel syndrome?
Well, the median nerve gets pinched in the carpal tunnel, and it gets upset, and it leads to numbness or feelings like your hand is tingling or asleep. And it's often these three fingers, it can be these two fingers, it can be these three fingers, it can be the whole hand. Everybody can be wired a little bit differently, so it depends. But it gets numb, and you sort of wind up sort of trying to shake it out. It usually happens at night when you're asleep. It can also happen with gripping, because when you grip, it increases the pressure in the carpal tunnel. So driving, holding books, hair dryers, doing your job can lead to symptoms of carpal tunnel syndrome, the numbness.
How do you diagnose carpal tunnel syndrome?
Well, to get it diagnosed, you really want to see somebody who's a specialist, a fellowship-trained hand and wrist surgeon. Basically, we do a history, meaning we talk to you, find out what your symptoms are. We do a physical exam, see if we can provoke the symptoms of carpal tunnel syndrome. Then we often use a splint at night when it's early on. If that helps at night, then it's usually carpal tunnel syndrome. Other things we do, we get a nerve study. It's where they run some electricity through the nerve, see how it's working, like running diagnostics on your car. That isn't 100% accurate, but that can be very helpful. It's pretty much routinely done. If we think you have carpal tunnel syndrome, but the nerve study doesn't pick it up because it's a little bit early, I can do an injection into the carpal tunnel. So if you go to the dentist because you have mouth pain, and the dentist numbs the tooth and the pain goes away, that's the tooth, helps confirm the diagnosis. May not treat it, but it can help confirm the diagnosis, and that can actually be more accurate than the nerve study. So in equivocal cases, I'll do that, or sometimes you can use it to temporize people, meaning take the edge off it for a while, like pregnant ladies you're not going to operate on, but they often get carpal tunnel syndrome, and the injection can help them hopefully get through until they give birth.
How do you treat carpal tunnel syndrome?
Well, again, it starts slow and it builds up and it progressively gets worse over time. But early on, if you just splint it at night, that can be helpful. The symptoms of carpal tunnel often happen at night because we all sleep in the fetal position. We flex our wrist and that pinches the nerve. In addition to the pinching, it's already getting the carpal tunnel. In other words, it gets double pinched, if you will. So the splint will keep it straight. That helps. If that doesn't work, you have the choice of living with it in cases where it's mild and it's not too big a problem, but it often gets worse over time. And most people eventually will wind up having it released, which increases the space available to the nerve.
What is the recovery time after carpal tunnel release?
Okay. There are different types of carpal tunnel releases. The old open incision had a lot of downtime. Then they went to the mini open incision, and that's better. Still can keep you down for a period of time. Then came the endoscopic techniques. There's a single and a double incision. They both put a small incision right here. The double incision also puts an incision in the palm of the hand. Common sense. If you have an incision in the palm of your hand, you'll have more tenderness over the palm. Take you longer to get back to use it. So the single incision endoscopic technique is one that I recommend. It's the least invasive. Basically, after surgery, we seal you with a super glue so you can shower or wash your hands immediately. I recommend not getting it dirty or submerging it underwater for 10 days. Activity-wise, you can do what you want, but I would avoid heavy gripping or lifting for about 6 weeks. You can do it. You won't damage anything, but you get more soreness and swelling about the hand and the wrist than you might want. Of course, if you enjoy that sort of thing, if you like the soreness and swelling, you should feel free to go for it. You can dial in just as much as you desire, just do more. But most people don't want to deal with that, and so they basically take it easy for about 6 weeks. But again, that's a preference. If you need to go back to to work, you can go back to work. It's just a matter of how much you want to suffer for your activities. You know, the endoscopic technique was originally designed for people with paraplegia where they had to walk on their hands immediately after surgery. And so you can do anything you want. You just have to be willing to pay the price a little bit.
Thank you for your time today, Dr. Budoff.
Thank you.